What if your body tried to warn you that a heart attack was happening? Would you recognize the signs? Every year, millions of people around the world experience heart attacks. Some survive because they recognize the symptoms early and receive immediate medical care. Others wait too long because they mistake the warning signs for something less serious. The truth is that a heart attack doesn't always happen the way it's shown in movies. It isn't always sudden. It isn't always dramatic. And it doesn't always involve severe chest pain. Understanding what happens inside your body during a heart attack may help you recognize why acting quickly is so important. In today's video, we'll explore what a heart attack is, what happens inside your body minute by minute, common warning signs, risk factors, and simple habits that may help support heart health. Let's begin. Your heart is a powerful muscle. Every day, it beats around 100,000 times, pumping blood throughout your body. Like every other muscle, the heart needs its own supply of oxygen-rich blood. This blood reaches the heart through small blood vessels called coronary arteries. A heart attack occurs when blood flow through one of these arteries becomes severely reduced or completely blocked. Without enough oxygen, part of the heart muscle begins to suffer damage. The longer the blockage lasts, the greater the risk of permanent injury. That's why every minute matters.
Most heart attacks happen because fatty deposits, called plaque, gradually build up inside the coronary arteries over many years. Sometimes this plaque can rupture. When that happens, the body forms a blood clot to repair the damaged area. Unfortunately, the clot may partially or completely block blood flow. The heart muscle beyond the blockage suddenly receives much less oxygen. Without quick treatment, heart muscle cells begin to die.
Within minutes of losing blood flow, the affected heart muscle begins to struggle. Cells can no longer produce enough energy. The heart may not pump as efficiently. As damage progresses, the electrical signals controlling the heartbeat can also be affected. This is why some people develop dangerous abnormal heart rhythms during a heart attack. If blood flow is restored quickly, more heart muscle can often be saved. Heart attack symptoms can vary from person to person. Common warning signs include chest pain or pressure, pain that spreads to the arm, shoulder, neck, jaw, or back, shortness of breath, cold sweating, nausea, lightheadedness, or unusual fatigue. Some people, especially women, older adults, and people with diabetes, may experience less typical symptoms. Any sudden symptoms that could suggest a heart attack should be treated as a medical emergency. Seek emergency medical care immediately.
Some risk factors cannot be changed. These include age, family history, and certain inherited conditions. However, many risk factors are influenced by lifestyle. These include smoking, high blood pressure, high cholesterol, diabetes, physical inactivity, obesity, poor diet, and chronic stress. Managing these factors may help lower the risk of heart disease. If you think you or someone else may be having a heart attack, don't ignore the symptoms. Call your local emergency medical services immediately. Do not try to wait it out. Early treatment greatly improves the chances of limiting heart muscle damage. Healthcare professionals can quickly evaluate symptoms and begin appropriate treatment. Minutes truly matter. While not every heart attack can be prevented, healthy habits may help reduce your overall risk. These include eating a balanced diet, being physically active, avoiding tobacco, managing blood pressure, cholesterol, and blood sugar, maintaining a healthy weight, getting enough sleep, managing stress, and attending regular medical checkups. Small healthy habits practiced consistently often have the greatest long-term impact. So, what happens during a heart attack? A blockage reduces blood flow to part of the heart. Without oxygen, heart muscle begins to suffer damage. The sooner blood flow is restored, the more heart muscle may be protected. Understanding the warning signs and seeking emergency medical care immediately can save lives. Remember, your heart works every second of every day. Taking care of it is one of the most important investments you can make in your long-term health. If you found this video helpful, don't forget to like, subscribe, and turn on notifications for more evidence-based health facts and wellness tips. Thank you for watching, and we'll see you in the next video.